Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I am live in studio. It's gorgeous outside. It's a beautiful day, and hopefully you're all out celebrating Father's Day and being kind to all those fathers that have blessed your life for so many years. In my case, you know what? I've got a family that is amazing. I've got children, I've got grandchildren, and it's just a beautiful thing. So hopefully all of you will celebrate today and honor the fathers that have been in your life. I'm broadcasting to you from 105.9 FM and AM 630 WMAL, and I'd love to take your phone calls on any subject. All you need to do is give me a call at 888-630-9625. That's 888-630-WMAL. I'm going to talk to you about several things today, some things in the news, some things that are relevant to the fathers that are out there, and if we have a little time, we're going to talk about a very, very special product. We're going to spend a few minutes on that, something that will actually turn a lot of things around for you. It comes from something called the reishi spore, which we'll get more in-depth into, and a product called Organoderma. And I normally don't get into supporting any kind of product, but this is something that I've been impressed with relative to its effect on the skin. So we're going to talk about skin rejuvenation as well as part of that. So don't go away, and we're here at 888-630-9625. I want to remind you that Ageless Health 2012 is coming up in October the 20th. It's our keynote presentation to you. It's a day that will change your lives, and those are the one that you love. We encourage you to be with us. It starts early, and we're going to be doing demos on core training exercise, and then we get into the meat of the program. And we have a special guest this year, Dr. Evan Mladenoff from Kansas City. Evan was the doc for the Kansas City Chiefs for 12 years, and he is a mover and shaker. He's written a book called Stressed Out, Headed for Burnout, and you're going to have the opportunity to listen to this man talk about the emotional side of healing. We're going to have vendors there, so you get to see what they can provide for you, and we're providing an organic lunch at the break and a Tai Chi Chinese martial arts demonstration, the soft kind, the stuff that all of us can do to relax and decrease our stress patterns and enjoy the moment. We'll get back into it in the afternoon, and again, the information is going to be power-packed. We're going to talk about the types of foods that you can eat on the run on stressful days so you can actually maintain a good, healthy lifestyle. So if you're interested in being well and healthy, this is your last opportunity to save 15% because tomorrow it goes off our website. Remember last week I told you this is the last week? Well, we're going to extend it one day only because we haven't had the opportunity to take it off the web. So go to our website at rosellecare.com. That's ROSELLECARE.com, and take advantage of the 15% deduction because it's already a very inexpensive day. It's only $99. But you know what? Save $15 and register now because after tomorrow, then it's full price, and we still would love to have you. And remember, seating is limited. Matter of fact, we sell out every year, so don't wait. Last year we had to tell probably a good 100 people that we're sorry. We don't want to do that to you, so call 703-698-7117. You can register by phone or go to our website at rosellecare.com and join us. Don't hesitate, don't neglect, and don't delay. Let's talk about a very special subject for men today. Well, at least let's start out the program that way. And we're going to take your phone calls as well. But let's talk about testosterone. You know, we're seeing all these hormone replacement ads out on the news, and I want you guys to get something straight. See, here's the deal. When you're not 18 or 20 anymore, your testosterone level starts to deplete. Now, you should never see it go away. It should always be part of your balance, making sure that you have good brain function, good arterial function, cholesterol levels stay low, blood pressure stays normal, you heal quickly, you have good muscle mass, and yes, gentlemen, that you still maintain good sexual participation with your loved one and the people that you want to be around. So, here's the deal. There's a controversy out there, and basically says that testosterone level needs to go away at a certain point, but, it really doesn't. And it also says that you have to replace it at a certain level, and you don't have to unless things don't work completely. But ladies, guess what? You need testosterone too. See, this is one of those back and forth situations. I mean, guys need estrogens, and women, you need testosterone. You need it for a lot of different reasons. Mental clarity, you need it to protect your body. You need to have strength in your system. You had to have it for motivation. No testosterone, no motivation. Goes away. Bye-bye. It's not there anymore. You feel like sitting in a chair and not doing anything anymore. Just kind of, oh well. And there's a lot of different approaches to making sure that we maintain this. But here's the deal with testosterone. Guys, when your testosterone seems to deplete abnormally at a younger age, or something suddenly happens and you go into the doc and he does a blood serum testosterone and he says, you got a problem here and that's why you're not feeling so good, there's a why is that? There is a cause. And let's talk about the causes, because people think it's just, well, I'm getting a little older, but sometimes it happens to younger guys as well. Or the receptor sites, those little lock and key things that we've talked about so many times with other types of hormones aren't working the way they're supposed to. They're not allowing for that hormone to get into the site that it needs to get to and work properly. Well, let's talk about depletion and let's talk about receptor site. So where does testosterone come from? Well, it comes from the testicles mostly. However, there's other different sites, including your fight-flight system, your adrenal glands, that produce small amounts of testosterone. And if we get older, that's supposed to kick in and be your fail-safe. Now, does it work all by itself? The answer, obviously, is no. In your brain, you have something called the pituitary gland, and that has an orchestration effect on many different systems, including the thyroid, including the pancreas, including every tissue virtually. Ladies, you too, the ovaries and uterus and so forth and so on. So when the pituitary is working properly, it releases something called LH, luteinizing hormone. And what that does for you guys, it allows the testicles to produce this hormone called testosterone if the receptors, the stimulatory receptor sites in the testicles are working. So then your testosterone level goes up. But sometimes trauma, injury occurs early on, and you get a blow to your head, you get into a fight, you have a car accident, even dental work. And that pituitary suddenly does not put out the levels of some hormones, sometimes all the hormones, the way it should, at the levels that it should. When you have pain in your body because of injury, because of damage anywhere, whether it's your spine, whether it's your neck, whether it's your low back, you increase the levels of inflammation. Your inflammatory levels go through the ceiling. Subsequently, when there's chronic pain or mechanical things in your body that aren't working properly, inflammatory levels stop the absorption of these hormones into your system, including testosterone. So we have this thing called trauma, and it can be any kind of trauma. It can be any kind of blow. So sit back a minute and think about all the bumps and the lumps and the bruises and the things that you've had, how many times you've hit your head, right smack in the middle or in the front, and you shake it off, and, 2, 3, 4 days later, maybe after a little headache or something called a small concussion occurs, and you don't give it another thought, with the exception that now you have some discomfort, maybe the back of your head, maybe your neck and shoulders, maybe your low back. And over a period of months, sometimes a year or two, now your body's energetic starts crashing, and you don't have the drive, and you don't have the motivation that you should have. your thought process isn't quite as clear as you'd like it to be. You go into the doc and you say, hey, listen, man, I'm not doing, as good as I used to do, and my energy's low and so forth. And if he's a smart guy, he draws not only a blood count to see what your iron level is and maybe your B12 level, but he also does some hormone patterns. Thyroid would be one of them, but he also said, let's just see what your testosterone level might be. Comes back, and guess what happens? Your testosterone level is low. It's not where it should be. Well, what do you do about it? You say, guess I'm getting older? There's nothing I can do about it. Remember what I just said. There's no such thing as total depletion. It may go down some with age, as it all does with all of us. Again, we're not 18 years old, but it shouldn't go away. You should still maintain muscle strength. The rules are that once you hit 60, your muscle strength should be maximized. Not necessarily your quickness and your reaction time, but your overall strength. 50 to 60 years old, you should be bull. You should be nice and strong. But it doesn't happen for all of us. And why doesn't it happen for all of us? Because of this crazy thing called testosterone and growth hormone and the like. So where do we start? How do we fix it? And we're going to talk a little bit about that today. We're going to put the pieces together, if you will. But remember something. When you have low testosterone, guys, even at a younger age, you get abdominal fat. Your belly gets big. It's that loose, watery type of fat that you just can't get off, and it's around your stomach. And when that happens, your insulin sensitivity. Remember we said receptor site problems? You can't get that hormone in either, so you can't transport blood sugar. And you start ending up with hardening of the arteries. All of this because of that silly little hormone called testosterone, and it's not working the way it's supposed to. Here's the deal also. Testosterone is the piece that enables the what they call the good cholesterol, the HDL, is actually a protein, to remove excess cholesterol from the arterial walls and get it into the liver and dump it and dispose of it and get it out of the body. So here's another piece. So that's why we see more hardening of the arteries as we get older, but unfortunately we see it in younger guys today because of inflammatory pathway problems due to diet, due to stress, but also due to trauma. So how do you know which is which? Well, you got to have somebody to really look at all those systems. First of all, if you have pain, and if you've been in pain for a long period of time, I guarantee you there's a lot of systems that aren't working the way they're supposed to. And you need to make sure that that pain is taken care of, and not by drugging it and putting something else to suppress it, which increases your inflammatory levels at another level, but fix the problem. If it's mechanical, if it's neurological, if it's something that has to do with, any of those things, they need to be dealt with by somebody who knows what they're doing. But if it's an inflammatory thing, then we have to look at what you're exposed to, what's going in your body, the kind of things that you're eating. All of a sudden, guys get grumpy. I call the effect Uncle Fred. Matter of fact, my next book is about the emotional side of healing. It's going to be called Aunt Harriet, Uncle Fred. And these are the grumpy people. They growl and they have all kinds of things. Aunt Harriet has more drugs in her pocketbook than the local drugstore, and she's gone to every doc in the world, and nobody's ever taken her off of anything. And kind of, Uncle Fred's the same way, and they're always complaining about something. We all have parts of our family who may resemble that, but nevertheless, the deal here is that we have a problem with low testosterone, the binding sites, so mood gets dampened down, and also your ability to remember, your cognition goes away. A lot of times when we get into that older age memory loss, situation, you go into the room, can't remember why you were there. That has to do with hormones not getting into the tissue the way it's supposed to. They're not transporting normally. It's an inflammatory reaction. It's a tissue damage type of situation. And, we want to throw all kinds of anti-inflammatories at these problems without answering the question, why? How come? What's the deal? Why isn't it working the way it's supposed to? So if you take the opportunity and really explore, do we have injury? Have we had head trauma? Have we had any kind of blows that we really never had anything done about, particularly by somebody who knows what they're doing about it, like somebody that does my work? But Or have we eaten ourselves into a hole? Or are we being exposed to electronic sources and so forth that are damaging our body, increasing our inflammatory reactions? All of these things can cause what we're talking about. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio. 888-630-9625. That's 888-630-WMAL. Love to talk to you. Any subject that you have in mind. We're talking about a special little topic for the guys out there because it's Father's Day, and happy Father's Day, everybody, on testosterone and what happens and why your risk of stroke and heart disease and cognitive dysfunction and all those things go down the tubes when your testosterone goes down the tubes. See, you have a lot of different things that are necessary. Estrogens, by the way, guys, for you are tissue protective, and sometimes you don't get enough conversion of testosterone to estrogen to protect your tissues, so you end up with damage to your body in a lot of different areas. But you have to have enough testosterone to make sure that everything else is working. You have muscle strength, you have the ability to have arousal, you have the ability to think, you have, it's important. Ladies, you too, but it's all proportionate. It's, how much do you have of one over the other? But unfortunately, because of injury, because of inflammatory levels, we increase our risk of stroke. We increase our risk of heart failure. And it goes on. And there's a lot of marketing out there that goes after you because they know these things. So instead of saying, okay, this is how you fix this stuff, they're going to say, well, you either have to put on a testosterone cream or we have to take all these other nutrients to protect the tissue and so forth. It starts with function. It starts with normal neurological function, which can be in most situations reversed if it's not normal. And it starts with making sure that you're eating well, so you decrease the inflammatory things that you put in your body. And then if you fail to do that or don't want to do that, then guess what you're stuck with? Then you got to put the creams and the gels and all those things and have at it that way. Testosterone decreases supposedly with aging, and aging is accompanied by reduced levels of all kinds of hormones. But the bottom line is, as I said earlier, they never should go away completely. But when they do and they go away too fast or they drop too fast, you end up with muscles that get, very, very soft. You can't work out and build any muscle. You don't feel like going to the gym and working out. But here's something that I've kind of beat the drum about for a long time and I want you to know about, is that when your vitamin D level goes down, your free testosterone also goes down. See, you have total testosterone like any other hormone, and then you have free testosterone, which is that's available to get into the tissue. So low vitamin D and testosterone levels go hand in hand. And so what you see is low vitamin D, low testosterone, then you see increased risks of all those things that we just talked about. So one of the quick tests without doing a hormone panel is just go do a vitamin D3 test. And if your vitamin D3 is low, then your testosterone is almost guaranteed to be around your toenails. So how do you fix it? Well, you fix it by increasing your vitamin D3. The problem with vitamin D3 is that if your inflammatory levels are up, you can get it up to a certain level, but the intestinal tract is responsible for absorbing it, the first part of it, the proximal part of the intestinal system. So a lot of you have no good bacteria. You have the problem of producing any kind of adequate amounts of enzymes that will allow that to absorb. And so when we have proteolytic enzymes, which are produced in the pancreas and so forth, are not available, then you have this catch-22. So where do you start? You start with, as I said, looking at trauma, looking at inflammatory pathways due to bad diet, the garbage, the sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives, junk that you put in your system on a day-to-day basis. You look at all of the minor electromagnetic fields that subsequently build up to a whole lot of things, your cell phones, your laptops, the jobs that you're working in, the electrical sources that you're around. All of those things have an impact. They have an effect, and they're going to knock it down. How many of you get out in the sun and just get out in the sun and enjoy it without putting anything on your skin? See, the problem is that when we go put suntan lotion on, it blocks the stimulation of melatonin receptors, so we can't produce vitamin D. And then it's a cascade. It's one piece after the other. But what I'm here to tell you is that all of this stuff can be changed if you do some very important things. What are you going to do? How about exercising? Exercise every day, gently, stretching, walking, doing things like that. How about changing the types of foods that are in your diet? Get rid of the glutens. Don't drink milk. Eat only organic foods. Drink a lot of water. Stay away from the excesses amounts of alcohol. And when you do, make sure it's good stuff and only occasionally. I mean, start with little things. Little things add up to be monumental. And I promise you, if you do that, and if you have pain patterns and you get rid of it, life changes. When we come back after the break, and we're coming up to the news and some very important messages, we're going to talk about skin aging, and we're going to talk about a very special product that comes from the reishi spore. And I want you to really understand what that is and what it isn't. And is it a panacea? Well, nothing is. But this product has some merit, and one that you can do your own homework on and find out if it's good for you. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. Happy Father's Day, everybody. We're here at 888-630-9625. That's 888-630-WMAL. Love to talk to you. We've been talking about testosterone levels for all of you fathers out there and guys that need to wonder why things are happening that you wouldn't expect them to happen, particularly at an early age. If I can be any help to you, obviously you can get a hold of me off the air at rosellecare.com. That's ROSELLECARE.com. And also remind you again, don't forget Ageless Health, October the 20th. Save 15%. Tomorrow's your last day because we're taking it off the website, and then it's full price, which is still inexpensive at $99. It's a full day to really find out how to change your life and get your wellness quotient up where it needs to be. Go to rosellecare.com. By tomorrow, save 15%. It's going off the website tomorrow. Then you're going to have to pay full price. Before we get into Ganoderma and skin aging and so forth, let's go to the phone lines. We have several people waiting. I want to take at least a couple of you. Laura, you've been very, very patient. How can I help you?
Hi, Dr. Tom Roselle. Thanks for taking my call. First of all, happy Father's Day.
Thank you very much.
And I have implants. I'm doing an implant on my one of my teeth, and I have a bridge. And of course, there is metal involved in all that stuff. So I've been getting headaches, and my blood pressure is rising, and it's just at a level that's not going down between 157 and 90 and over, sometimes 170 over 100, and it's really alarming me.
Okay,
I don't know if these are having an impact on my blood pressure.
Let me talk to you a little bit about that because we only have a few minutes to answer. But let me say this. Dental implants, there's a lot of controversy with the implants simply because of the fact that the titanium that they use in the implant is not pure titanium. It's a mixture, and it can be mixed with aluminum. It can be mixed with palladium. It can have other bonding agents to it. So you have to be very, very careful. It's unfortunate that these are routinely placed in people's mouths, but dentists today are going to implants more so than full extractions or root canals. They say, well, it's better to take it out. Well, when you do a root canal, there can be residual bacteria left if it's not done properly, and even when it's done properly, sometimes it doesn't get it all. Periodontal surgery is, one of those things that we don't know a lot about, and as far as its ramifications, as far as dentistry is concerned. Now, the things that I'm going to say to you, and we've talked about them before on the program. First of all, you have to look at the material and whether or not you're sensitive or you're allergic to that, and there's ways of doing that through hair analysis. There's an acupuncture test called an EAV that will also show up metals and sensitivity. You have to look at the status of the person's mouth and whether the bone can handle the implant as well. The habits of the patient, long-term relative to will the implant stay in position, and if a patient grinds or wiggles their teeth, and when they clench their mouth, or if they're smokers, or if they chew tobacco, or if they eat hard things or chew on pencils and so forth, the implant may not last as long, and it may cause more damage over a period of time. The status of the mouth itself has to be considered. Is there any other bridges? Is there anything else that can be compromising? Now, here's the other piece. Every tooth in the mouth has a relationship, or every segment has a relationship to body function, has a relationship to other spinal levels, has a relationship to organ systems, and when the implant is put in place, it can have an effect. Anything that a root canal can have an effect, an extraction can have an effect on that acupuncture circuit or on that organ system or that part of the body. So when a patient comes into our office and I see that they've had implants or they've had root canals and so forth, the first thing that I'm going to explore are the relationships between those teeth that they've had work done on and different body parts and so forth. So it's not just a simple yes, they're safe or no, they're not safe, or should I do it or shouldn't I do it. You have to take a lot of different things into consideration. And it's, I wish I could be much more specific, but unfortunately I can't.
But the headaches I'm getting, could this be part of this thing, metal in my mouth?
Yes, absolutely.
I'm sure. I thought so. And they did also bone grafts, so
doesn't matter
where this bone comes from.
It's cadaver bone. That's all it is. It's cadaver bone. It's another person's dead body. They took the bone, they ground it up, and they put it in your mouth, and that's what they do with it. Laura, it's a subject we actually really could talk about all day. But
I want to come to your clinic, and if I call, would I be able to get you to look at my cases?
I take new patients, but sometimes you have to wait quite a while for me, but other doctors in the office are quite capable as well. But give us a call, Laura. You can just go to rosellecare.com or call 703-698-7117. Let's talk about the subject. We have a couple more people online, and I will take your phone calls. However, let's talk about the face and aging and so forth. There's a product out there called Organoderma, and I was asked my opinion on it. And it says that it's naturally organic and, so forth and so on. But the one product that has got my attention is something called G3, the premium beauty soap. And it's made up of Ganoderma, grapeseed oil, and glutathione. All of those things are great. Now, what is Ganoderma? Ganoderma comes from a mushroom. And that mushroom, often also called reishi, and there's a red mushroom that most of the highly metabolic components come from. We recommend patients to doctors who use reishi spore for anti-cancer therapies, and it seems to have an effect. There's a lot of research that's being done with Ganoderma mushroom, and particularly the red mushroom, which produces the reishi, but it has to be the reishi spore when it comes to protective elements of cancer and antioxidants. So here's the deal with this product. I have several patients who have been using it and have had very significant acne, body acne, facial acne, a couple young girls that are using it, and it seems to be extraordinary. I'm looking at them. They haven't changed anything else. They haven't changed their dietary patterns, and it's beginning to clear up their skin. And the active ingredients are those that we just talked about. Now, these are high antioxidant substances. They begin to protect the tissue. They will pull toxins out. Glutathione is one of those things that everybody needs, particularly if they want to get rid of any toxic element in their body. The liver cannot work without high levels of glutathione. Some patients have a very difficult time producing enough glutathione to make any difference. So when you put on something like this product, this Organoderma G3, and it has these elements in it, there's going to be an effect. And obviously, based on what I've observed, there is. And it seems to be quite a significant effect. The grapeseed oil is a product that we've used in practice and recommended patients, to use. It contains a very, very high level of antioxidant polyphenols, and it's a natural base of seeds, from wine producing. So at the end of the wine production, they make your wine, then they take, the seeds that are in the grape, and then they process them again. It's extremely effective at restoring damaged skin and irritated skin. We've had patients actually take, and I've told them over the years to take the grapeseed oil and put it on their skin or their scalp, and rub it in, let it set for a period of time. But here's a product, if you will, that combines some aromatherapy products, the oil of the grapeseed. It has the glutathione in it, and it seems to have a profound effect on the skin. So, Ganoderma is, as we said again, is reishi spore. It's an excellent extract. It has anti-tumor effects. Some patients say that when they use it on the skin, it actually will help them with some of the basal cells that they have, and I'm not saying it does. I'm not supporting it in that way. That's some of the things that you can look up on the net. The reishi plant has been shown to be excellent in preventing the tumors. When I said it, remember I said it has to be the reishi spore in our opinion, and it's the red mushroom extract that gets it. It's been shown to effectively manage all kinds of different types of skin conditions when ingested. It also has an effect on the internal organ systems. Reishi is collected generally from the spore if it's done properly, so you have to be careful when you look at the product. And the spore itself is so much more potent. Some authors will say anywhere from 75 to 150 times more potent compared to other types of reishi products. It contains different types of amino acids and polysaccharides, which lends itself to helping the skin and maintaining the integrity of the skin, and also pulling out a lot of the toxins that are there. There's some research that's going on right now with HIV patients utilizing this, as well as different types of cancer patients. The Japanese government has officially listed reishi spore as an adjunctive herb in dealing with cancers. And in China, reishi is also used daily to promote better health and sleep and increase resistance and infections, or help infections resolve, and heart disease. And it seems to be one of these things that is almost too good to be true. But with our experience dealing with reishi spore or Ganoderma product, we see patients that seem to have significant resolutions. There was one study that showed tremendous results. That they went up to 84% of the people that use this in this Japanese hospital turned things around, and they were dealing with, I think, somewhere around 60 different cancer patients. So it's an amazing product. So if you want to know more about it, you can actually, I think we're going to put the soap online at rosellecare.com. Give us a few days to get it out there. You can get a hold of our office at rosellecare.com, and I'll have somebody contact you if you want more information. But this product seems to be good. I don't see any side effects with it. So hopefully I've answered the question. I did a little research, and it's a real deal thing. I'm going to come back to our phones in a second. We have several people waiting, and we're going to talk a little bit more about rejuvenating and aging the skin, and we're going to talk a little bit more about this product as we go through the day. Bill, how can I help you, sir?
Yes, happy Father's Day.
Thank you. You as well.
Yes. I don't have any kids, but...
Well, that's all right, but we are all fathers in one sense or another.
Yes, I guess you're right. I have this pain on the right hip, and radiates down my leg, down my knee, and comes and goes.
Bill, when is it the worst? When you're laying down, sitting, standing, walking?
I guess when I'm laying down.
When you're laying down? If you get up and walk around...
I'm sitting also. It's hurting right now.
Okay, so if you get up and walk around, does it feel better?
Sometimes, yes. Sometimes, no.
Okay. Now, there's a condition called sacroiliac with a sciatic distribution. The sciatic nerve is actually 5 nerves. It's not just one.
Yeah.
And when the sacroiliac goes out of position because the muscles are not holding it in place, will overstretch, it'll irritate, it'll compromise the nerves that go down. So generally, if you're sitting, it'll be more painful. If you get up and start moving around, at least for the first few moments, it may begin to relieve it, because as you're moving, the hips are moving, and it's pumping the fluid out of the sacroiliac joint. If you walk too far, or if you stay on your feet too long, then it hurts even more. So it's one of those compromising situations. Now, I don't know what the situation is specifically with your problem. How long has it been since you've had the pain? Is it something that just came about, or is it something that's been there for a while?
It's been a few weeks.
Okay.
I've had it before, over the years, but comes and goes and completely goes away.
Are you a coffee drinker?
Not much.
Okay.
I drink green tea.
Okay. Do you have a sweet tooth?
Not really. No, I don't even use sugar in my coffee.
Okay.
I mean, in my tea.
Okay.
I eat a lot of cheese.
Okay.
A lot of cheese.
Okay. Bill, it's one of those things that, symptoms are symptoms, but it sounds like a sacroiliac problem to me. It can come anywhere. In fact, it's going down your leg. It's coming from the low back portion of your spine. It probably from somewhere between the 4th, 5th nerve root down to the 1st, 2nd, and 3rd sacral nerve root. But to find definitively, we'd have to examine it. The fact that it's relatively recent, even though that you had it in the past, tells me that you're doing something, or there's a piece of your lifestyle that has contributed to this thing. But if I can help you in any way, give me a call or get online with me.
Lifestyle, you mean the way I eat?
Yeah, I mean, a lot of times, just when you eat things that you're allergic to, you can cause an inflammatory reaction to the joint spaces. But here's the other piece. Remember, I said over time that every muscle in the body has an organ system that it's related to. So the thigh muscles, the quadricep muscle relates to the small intestine. The hamstring relates to the colon. You have a long muscle in the front called the sartorius, and it comes from the front of the hip all the way to the inside of the knee. That relates to the fight-flight system, your adrenal glands. And if that's not working the way it's supposed to, then we got a problem. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We've had some very interesting topics for you today. Again, happy Father's Day, everybody. We've been broadcasting to you from 105.9 FM WMAL, and we're here every Sunday at 12 noon trying to bring you the most up-to-date information that we can. Talked a little bit about testosterone for all you guys. Remember, it's a fixable deal. It's something that you can turn around. You don't have to live with the low drive, low impedencies, and so forth that are associated with that. Remember, it's either trauma, receptor site problem, high inflammatory pathway problems. A lot of these things can be fixed. By the way, got a text while we're on the air, and I'm supposed to tell you that my staff is extremely, extremely efficient. And if you go to our website at RoselleCare, RoselleCare.com, and you go to our iStore, click on iStore, go in, then you'll find that soap that we talked about is already there. So the Organic Gold Premium Beauty Soap, the G3, is there. And as we said, it's a combination of Ganoderma, the reishi spore extract, grapeseed oil, and glutathione. And they also put up organic green tea that is made with the reishi spore. Good stuff. Many of you asked me about sunblock, and we talked about 3D rock sunblock, and that's there. It's non-toxic and it won't kill skin cells. It's all natural, strengthens your immune system. So again, visit our iStore. It's there, as well as my book and Dr. Mladenov's book, Stressed Out, Headed for Burnout. Take a visit, take a look around our site, and also remember, Ageless Health 2012 is coming up October the 20th. Don't delay, 15% until tomorrow. We're here every Sunday. Hope you will be too. Tell your friends and your family about Dr. Tom Roselle Live, and any questions that you may have offline, RoselleCare.com. That's how you find me. That's how you get it to me, and we will always do our best to make sure that we keep you as our primary number one consideration always. I'll see you next week. Happy Father's Day. This is Dr. Tom Roselle. Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live, Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at RoselleCare.com. Suffering from chronic health problems? Tired of taking dangerous drugs? This is Dr. Tom Roselle, host of Dr. Tom Roselle Live. Join me on Saturday, October 20th for my Ageless Health Seminar, How to Live Well and Prosper in a Stressful World. And I'll show you how to increase the quality of your health and length of your life. Saturday, October the 20th at the Fairview Park Marriott Hotel, Falls Church, Virginia. Seating is going fast. Don't be left out. Register today at rosellecare.com or by calling 703-698-7117. Are you looking for great tennis instruction in a dynamic, challenging, and fun environment? Hi, this is Dr. Tom Roselle, inviting you to visit rjtennis.com to learn about the most popular adult tennis program in the metro area. RJ Tennis programs are packed full of energy and non-stop tennis. With exhilarating drills and games, RJ Tennis will energize your game, fitness, and life. So call a friend and sign up today at rjtennis.com. That's rjtennis.com.
Did you know that breast cancer is on the rise and that routine annual mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? The result could increase the risk of developing breast cancer. Now, consider a simple, non-invasive, and totally safe adjunct medical procedure approved by the FDA, which can detect evidence of breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect initial signs of breast cancer, such as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call Thermography Centers at 888-485-7736. That's 888-485-7736. And for more information, visit thermographycenters.com.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and include a thermographic breast scan as part of your annual wellness checkup.